InnerQuest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, and welcome to InnerQuest. My name is Jay Stone, your host for today, and our guest is psychiatrist Dr. Dawna Gutzmann. Welcome, Dr. Gutzmann.
Thank you.
What do your patients call you?
Usually Dawna.
Is it okay if I call you Dawna?
Yeah, absolutely.
All right. Dawna is a psychiatrist who has used an integrative approach for over 20 years in the Chicago area. Dr. Gutzmann received her training in psychiatry at Northwestern University School of Medicine and continues to study a wide range of complementary healing methods. Well, where do you practice? Do you have offices in the Chicago area?
I do. I have a private practice. My main office is in Skokie, and I have another office in the Chicago Loop across from Millennium Park.
Oh, that must be a nice... Do you get a nice view?
Oh, beautiful, yeah.
Good. And why don't you tell our audience what integrative psychiatry means?
Sure. Integrative psychiatry is the practice of treating mental health using conventional Western medical approaches and integrating alternative treatments, non-medication treatments.
Well, I remember the last time I interviewed you, which I loved, you brought like a light machine. And is that an example of an integrative approach?
Yeah. The use of light for affecting the brain is an example.
And are you still using that?
I am.
And so what are some of the problems you would prescribe light treatment for?
Well, that particular light I use actually for when I do hypnosis, because it induces a state of trance.
I can testify that because you let me use it once.
Yeah. But, a lot of people already are aware that light therapy is used for seasonal affective disorder, people that become depressed when the length of the days become shorter, the daylight hours. But I also use a type of light therapy that I'm trained in to help people resolve traumatic memories. And our brains are very sensitive to the effect of light.
Yes. You want to elaborate on that? Let's say natural lighting. I think in Europe, in some European countries, it's against the law not to have natural light or be by a window because I think it's cruel.
Oh, really?
Yeah.
There's something to that, yeah.
Yeah. You want to elaborate on lighting and effects on health?
Well, I don't know if I can really speak generally about it, but the optic nerve comes off the back of the eyeball, and it goes, almost to what you might say is the center of the brain, where the pineal gland is located, and that's the part of the brain that that governs the sleep-wake cycle and a lot of our hormonal systems. And then there are projections to the back of the brain from that area that are, part of the visual system. And then from that part of the brain, there's our association pathways to virtually every other area of the brain. So when light stimulation comes in through the eyes, literally it can impact the entire brain. And so different wavelengths of light, if you flicker the light, it can have different effects on the brain and processing information and just the state of brainwave activity.
And what kind of results have you seen with light therapy?
Well, I've seen people resolve traumatic memories much faster than they could through conventional psychotherapy.
And when you mean traumatic memories, let's say abuse from childhood, or like an accident or a serious illness or injury when somebody was young.
Yeah. Mm-hmm.
Okay. And what happens if we don't treat a traumatic injury?
Well, you know, probably many people that have traumatic incidents happen during childhood live with the impact their whole life, and they, I guess we're pretty resilient beings, human beings are, and so probably they function reasonably well. But it's those people that that have symptoms that often will seek out treatment. Hopefully they will.
I would assume it could lead to, let's say, veterans that have alcohol or drug abuse from traumatic injuries.
Right. If they don't seek treatment or they don't get the appropriate treatment, it could lead to substance abuse or even suicide.
Can you name some of the physiological factors that can cause mental health problems or complaints?
Sure. So physiologic factors could be things like traumatic brain injury, and I think we've seen that with, you know, some of our star athletes that have had a lot of concussions over the years and end up with severe depression, even suicide.
Right, with the Bears, Dave Duerson committed
Right.
suicide, and he actually deliberately shot himself in the chest so that his brain could be studied. And then a Hall of Fame football player from San Diego by the name of Junior Seau, he also committed suicide.
Right. Yeah, so traumatic brain injury can cause lots of mental health complaints, depression, dementia, anxiety, cognitive decline. Exposure to toxic substances can affect brain function and can present as, you know, symptoms of a mental illness. And I think you know an awful lot about that personally because of your interest in that.
Well, and I did have the good fortune to interview neuropsychiatrist Daniel Amen, and he really taught me a lot. But then to start to see some in my clients, like that a client who knocked herself out playing hopscotch, she just fell backwards. Or another client, when she was a young girl, 10 years old, got hit by a car and was unconscious for 10 minutes. Or a man with severe phobias who fell off a swing set, or a swing. He just went too high, and he said, "Yeah, I got me fixed up. I had surgery on my shoulder." I says, "Yeah, they might have fixed your shoulder, but your brain." And so, so there's a lot more awareness about traumatic brain injuries or TBIs.
Yeah, there are. And I actually saw, I haven't read the article yet, but I saw an article the other day showing a link between exposure to air pollution and the incidence of attention deficit disorder, just showing the relationship between toxic exposure and then brain impairment leading to mental illness.
And I would assume children are more vulnerable to air pollution because they're smaller and...
Yeah, and their brains are still rapidly developing, so it can influence, the development.
Is there anything that we could do to offset some of the harmful effects of air pollution?
That's the thing. We don't really have that much control over air pollution, but living in a less congested area is one idea, although commuting is, tends to expose you to more air pollution. So, using air filters in your home is another possibility. Trying to support measures by our government to clean up our air is another.
Well, and I know psychologists and psychiatrists, they're doing more what they call, I guess, community psychiatry or community psychology. We're interested in improving the environment for people, such as looking for better air quality. Yeah. Now, what about, let's say, exercise or meditation that increases the blood flow to the brain. And you know, it's good for the cardiovascular system. Do you think that could reduce some of the effects of air pollution, or would it even make it worse because you're breathing more of the polluted air in?
Well, you know, I don't know that it would directly influence the effect of air pollution, but definitely moderate exercise, eating healthy foods, organic foods, getting enough rest, managing stress through things like meditation and yoga.
Good, healthy living.
Just healthy lifestyle really supports our body's health, reduces inflammation in the body, and more modern science is showing the link between inflammation and a whole range of chronic illnesses, including mental illnesses.
Well, I know inflammation was one of the questions on my cheat sheet here, so why don't you tell our audience what is inflammation and why isn't it so important to limit it?
Yeah, I mean, I think virtually anyone has experienced inflammation. For example, just getting a sunburn or a cut, you know, the redness and swelling that you see around the area of injury. And it's a protective response by our body to protect us from infection.
Is that part of the immune system?
The immune system is involved, and the circulatory system, the lymphatic system. So it is a protective measure by our body. And I mean, it helps to keep us alive, prevent infection. But if we're constantly exposing ourselves to things that produce inflammation, then you know, constant inflammation in the body ends up causing tissue breakdown. So things that cause inflammation would be, for example, the toxic exposure that we talked about, or it could be exposing or eating foods that are unhealthy that cause inflammation in the body.
But a lot. If somebody's eating foods that's causing inflammation, shouldn't they be able to make a connection, go, you know, when I eat this, I don't feel so good?
I don't think people, I mean, I think some people have that kind of body awareness, but the impact of eating the food, the negative impact isn't an immediate effect usually. The immediate effect is the pleasure of the taste of the food and the content of the fat in the food and the content of salt and sugar in the food. So that gives the immediate pleasure, and then the longer term effect is the negative effect. And you know, our primitive brain doesn't make that connection. You know, our primitive brain responds to the here and now, and it doesn't necessarily make that connection to like long-term detrimental effects.
So would you say the primitive brain is more immediate gratification, and other parts of the brain, the more recent parts of the brain, are delayed gratification?
Yes, definitely.
Okay.
Yeah.
All right. And can you give some like clinical examples where your patients have had inflammation and what you observed, and maybe how you tried to help that person?
Sure. Well, you know, in terms of, I mean, I have an integrative approach, but I pretty much focus on mental health issues. And so it's really not possible to directly observe inflammation in the brain because, you know, we can't see the brain. But so there are some laboratory markers that can show evidence of inflammation in the body, such as C-reactive protein. And when there are those, you know, indicators that there's inflammation in the body, then usually the treatment would be to recommend dietary changes, you know, and some of the healthy lifestyle changes that we talked about.
So you ordered lab tests?
Yes. Yeah.
Okay.
Right.
Good. Now, was this something you learned in medical school at Northwestern, or is this something that came afterwards? You got interested in this?
This came afterwards, but this, you know, and this is something that holistic practitioners have been talking about for, you know, for many years. The the effect of inflammation on health in the body. But now, modern science is confirming that theory, that it's inflammation that kind of fuels a lot of our chronic illnesses.
And would autoimmune diseases involve inflammation?
They do, yeah. It's when the person's immune system is attacking them and part of that attack is an inflammatory reaction, and that causes tissue damage.
Now, are there any medicines you prescribe for inflammation, or you think diet and exercise and lifestyle changes are probably the better ways to go?
Well, there are medications that have anti-inflammatory effects, and aspirin is an example.
Mm-hmm.
But there are actually some herbal products that are probably as good or better than aspirin, because aspirin has some damaging effects in the.
It just warms my heart to hear a psychiatrist talk about herbal remedies. And I know you're not prescribing any herbal remedies to our audience now, but can you talk a little bit about herbal remedies?
Well, two of the big, I guess you'd call them herbal remedies to treat inflammation and reduce oxidative stress in the body are N-acetylcysteine, which is a supplement that you can purchase over the counter, and it's a precursor to glutathione, which is an antioxidant that's ubiquitous in our body.
So is this like a pill, or can you make a tea of this herbal remedy?
It's usually in a capsule form, and another one that's getting a lot of attention is called curcumin, which is made from the spice turmeric,
Mm-hmm.
and it has really powerful antioxidant, anti-inflammatory effects.
Okay. Now, when I think of herbal remedies, I think of, traditional cultures and societies that would just use it as part of their diet, their cooking, like turmeric.
Yes.
Yeah. So, great. And do you ever recommend, like, to your clients, take some cooking classes, like learn how to take care of yourself?
I haven't really recommended cooking classes, but I've recommended dietary changes, and I guess I've probably left it up to them to decide if they need to get more skills in that area. But
Yeah. And what other healthcare professionals, because you do an integrative approach, so what other kind of healthcare professionals do you work with?
well, I have a solo practice, but when clients ask me for referrals to other physicians that have an integrative approach, I know a number of physicians in the Chicagoland area that are very experienced and excellent integrative physicians that I can refer people to.
Yeah, isn't there like a holistic physicians group, or is there an integrative physicians group too?
You mean like an association, like
Yeah.
a formal professional?
Yeah.
There is. I'm not a member of any actual professional groups, but I attend conferences every year and meet other integrative physicians from around the country and even around the world, actually.
Yeah. Well, you have to take continuing ed every year.
Right.
So.
Yeah.
Okay. What is higher brain living?
Yeah, higher brain living. That's something new that I've learned about and that I'm offering to some of my patients. It is a gentle touch technique that is a program for personal transformation. And basically one of the major effects of getting this gentle touch technique is that it actually activates the prefrontal cortex of the brain, which you were kind of alluding to earlier. It's that part of our brain that has the capacity to see, to see our future, to think about consequences and make decisions based on, rational reasoning.
Well, I learned it was the brain's executive center, the forward-thinking part of the brain. Here we are, and here's a better place we can go. And correct me if I'm wrong, but isn't that the part of the brain that we learn from life experiences?
Well, I would have to say that every part of our nervous system learns from life experience.
Well put. I
Yeah.
like that. I like that.
But, that the prefrontal cortex is also the part of our brain that allows us to experience what you might call extreme states of extreme well-being. They're it's more than just simple pleasure. It's an example would be gratitude. That involves both a recognition of blessings that you have, and then the experience of pleasure. Another example would be
Love?
well, I don't know. Love is
Limbic system?
yeah. I mean, that involves pretty much the whole body, but inspiration is an example. A sense of meaning in life is another
Purpose.
example. Purpose. These are all experiences that we need our prefrontal cortex to have those experiences. And most people would say those are peak experiences when you're really feeling a state.
Talking Maslow now.
Yeah.
Yeah. One of my
Yeah.
favorite books he wrote, Maslow wrote, is called Peak Transcendental and Religious Experiences.
Yeah. So feeling connected, feeling a sense of contribution,
Higher purpose.
higher purpose.
Requires higher brain living.
Yeah. Yeah.
But the incidence of attention deficit disorder is on the rise, and now my understanding, you're the expert, but the prefrontal cortex is involved in attention deficit disorder?
Yeah, it is. Yeah.
Yeah.
I mean, that's not the only part of the brain. Our ability to focus involves, the brainstem and, other parts of the brain as well as the prefrontal cortex. But that's the area that is targeted in treatment.
Yeah. And so I assume, do you work with patients with ADD?
I do, yeah.
And so what are some of the more your approach, the integrative approach to ADD?
Yeah. Well, because I have an integrative approach, I'm not anti-medication. And, but it's my goal to try to get the best result for clients using the least amount of medication. So I offer them, knowledge about alternative treatments that could help their focus and attention, and other symptoms of ADD to, like I said, get the best overall result and limit the need for medication.
Yeah, so I was hoping you'd say, what are some of the alternatives?
Well, just healthy lifestyle for one thing, making sure that you're getting enough sleep, exercising regularly. That's been shown to be helpful for ADD as well as, most other mental health complaints. Making sure that, if they have any food sensitivities or allergies, that they're not exposing themselves to those foods on an ongoing basis. There are some supplements that can enhance the functioning of the brain. Or, an example would be omega-3 fatty acids. And most people don't get enough of that in their diet, so they may need to supplement it. And there are also brain entrainment devices that can help increase beta activity in the brain. And
I assume there's some CDs you can that help that.
You can use sound to enhance beta activity in the brain, just like you can use sound to increase alpha or theta or delta waves.
Well, one thing I remember from my studies with Dr. Amen, he said like 20 to 30% of the calories we consume go to fuel our brain. And so it's like 20 to 30% of all the calories we go to eat is going to run our brain. So I want my brain to function as best as possible. So,
Yes.
so I said to Dr. Amen, I said, there's a book, Eat Right for Your Blood Type, and now he's going to say, eat right for your brain type. Yeah.
Yeah.
And let's see. This is I wanted to ask you. Explain transcranial magnetic stimulation for our audience.
Oh, okay. Yeah, I'm really excited about that. It's a new treatment that I'm offering. Well, it's new to me. You know, it's newly being offered in my office. It's actually not a new treatment. It's a non-medication treatment for what we call treatment-resistant depression, and it's been approved by the FDA since 2008. But I just purchased the device at the beginning of this year and have been offering this treatment to patients.
Well, our audience may not know what treatment-resistant depression is. I've got a good hunch what it is,
Yeah.
but why don't you explain that?
Okay, sure. It's defined by, you know, the conventional medical definition of a person who's had a trial of at least 4 different antidepressant medications, and either they haven't been able to tolerate the medicines or the medicines have not worked sufficiently. And the person has also had adequate trial of psychotherapy and not gotten a remission of their symptoms. And what the transcranial magnetic stimulation machine does is produce a magnetic field that's highly focused, and we can deliver that magnetic field to a specific part of the brain, and it's a pulsed delivery, and it activates the neurons that are in that area of the magnetic field.
How long will you use that machine to stimulate the brain?
Well, the treatment protocol for treatment-resistant depression is actually a series of 36 sessions. And the person will come in usually 5 days a week for a session lasting about 40 minutes. So it's a very time-consuming type of treatment, but, many people
are in need of it.
They're in need of it, and it actually some positive things about it are that once the treatment is over, they get up, they go about their day. There's no after effect other than, remission of depression, and it really has virtually no side effects, so it's pretty remarkable that way.
Well, that 60 Minutes correspondent he's been open about his depression for like 70, 80 years. There are people that have suffered horribly with depression for extremely long term. So I'm really glad to hear about this treatment.
Yeah, it's really a great advancement because it is non-medication, and often people are able to reduce, if not eliminate, their need for medication and feel better than they have in years. So it's a real great development.
Dawna, I'm sorry, but we're out of time. For more information about Dr. Dawna Gutzmann, Infinity Foundation, Inner Quest Talk Show, stay tuned to the credits at the end. Until next time, wish you good health, good fortune, and good spirits. Thank you, Dawna. It's been a
Thanks,
pleasure.
Jay.
For more information about this show, our guests, Infinity Foundation, or any of our other programs, please visit our website, infinityfoundation.org, or call us at 847-831-8828. infinityfoundation.org, or call us at 847-831-8828.